So this is really how it starts. When they come in, you can see it's very person friendly. You see the beautiful smiling face of the Black mother right here on the front, at the entrance. But we do take a moment to explain to them what this is for and what it's about. Again, we are not trying to take anyone's power away. We want them to know every step of the way. Your voice matters, your experience matters, and we respect your privacy. Share with us what you will, and if there's something that you'd rather not share, we respect that as well. Women who complete this survey will have the ability to start it. If they're not able to finish it in one sitting, they can come back and then complete more of it later. So it is truly designed for their convenience. So here you see the first questions that we ask. This is really focused on the mom. So we want to know where they live. And right now we're going to be focused on 2 counties, of course, but we will have the ability to add other counties as this expands. We want to know how old they were, their zip code, because we're really just trying to get an understanding of the base, kind of demographic that we're going to be serving. Who was more likely to respond? And then based on who responds, what are their experiences per segment? So we do look to get as much of that information as possible at the outset. And so we dig a little bit more into the very generic data here of, when did they give birth? Was this their first pregnancy? Because that could have implications as well. And you'll see some of the questions as we go through. If we find that for the first pregnancy, women who were kind of just starting down this maternal health journey, do they have a different path that they follow? Are they more likely to get supports or less likely because they're less likely to ask some of the questions? So we want to know that so we can be able to cross and compare data. And we do ask this most critical question: how did it end? Because we know that some end in heartbreak. Some women are able to follow through and their children are able to live, but then some are not. And we want to be sensitive to that and allow them to tell their stories as well. So the way that the survey is set up, just for all of your information, it is set up in sections so that we can allow them to provide the feedback that's very specific to a certain phase of their maternal health experience. So the first, of course, is prenatal care. We know that this is extremely important for women to ensure a healthy and safe pregnancy, that they're getting the proper prenatal care. And on the First Lady's launch yesterday, I think we heard a couple of stories and people in their experience with this phase. So we know that this is critical. So these are some of the questions, not all of them, but we want to know, where did they receive the care? Are there specific practices? How did they pay for it? We heard a young lady talk yesterday about, she felt that because she was Medicaid that she was treated one way versus another. So we want to understand that, how did you pay for it? Did you think, and we asked this question on this survey, how you paid for your care influenced how you were treated? And that's something for all of you to know as we went through this entire process. We want them to be able to give their voice. It's not just what we want to know, but it's what they want to share. And so we give them the opportunity to let us know that part of the experience. Their perspective is important. So again, when you look at some of these questions for prenatal care, you see here, how were you treated by the front desk staff? When you walked into the front door, what did they do? How did they treat you? We know that when we walk into whether it be a store, some sort of retail establishment, our doctor's office, the first moment of interaction is extremely important, and it sets the tone for the rest of the experience. So we want to know what that's like, because we're, of course, understanding that some of these providers, these practices, these hospitals may want to know that as well, so that they can make internal training and decisions on their own. We also want to know, when they think about these visits, how true were these statements? Did they take time to listen to you? Did they give you the attention you needed? Did they take action in response to your questions? That's key. Like Serena, what Cheryl just mentioned, she said, these are the issues that I'm dealing with. What are you going to do? Did they act to it? And then one of the things we wanted to also find out about was appointment setting. If it was difficult for you to schedule an appointment, why is that? Was it transportation, childcare? What were the reasons? This information is so important, because if we understand that in Atlantic City that women are not receiving prenatal care, the leadership is going to want to know. If it's transportation, then maybe we should be having conversations there. If it's an issue with childcare, then maybe there's some resources and some supports that we need to be bringing to bear. So it's very important to understand what barriers may exist, so that we as leadership and team and community members can be able to address them. we're looking for honest feedback when it comes to this entire survey. So was there a time that they raised concerns? Is super important. But if you did raise concerns, how was that experience? Did you get what you needed? Did they treat you as a collaborator? Did you feel supported? So a lot of the information we're looking for, and even do you think your race or ethnic background influenced how you were treated? We want their opinion on that. And that was something that we all talked about. That's kind of difficult to scientifically prove, but we all know who've been at the other end, the receiving end of racism and bias. It's kind of hard to put your finger on, but you know it when it's there. So that is something that we wanted to capture as well. So for each section, and this is really for each one of the sections, but I just called the one out here, we allow them to tell their story. We allow them to put just free text in something that they experience that they want to share, because there are some things that maybe we can't capture in a checkbox question, but we want to hear from them. And so we're going to give them the ability to share their personal stories as well as part of this survey. And then, of course, the second part of the phase is labor and delivery. What were some of the things that they experienced? Some of the different questions that we ask here is, was there a support person included in discussions? So, and we have questions here about doulas and family members. Were you allowed to have support in the room with you? Because we know a key part of ensuring success is the advocate, and having an advocate who's there to help when you don't have a voice, to be your voice for you. So we do have some of the questions here about raising concerns and if there was a response to that through the process. And then some of the other things that we want to know is, did you feel uncomfortable asking questions during labor and delivery? It's a high stress time. So was there, because of your earlier experience, was there something that stopped you when you most needed to get an answer from asking the questions that you needed? And if so, why? And then here we just allow them to, in a very free way, to let us know all of the different ways that they felt during this phase of the process. What they're afraid, confident. We know there's a lot going on, but we want to see if there's some consistency with how people felt, especially depending on, where they were being supported, where they were receiving their care, and where they weren't. So that's also something that's going to be important for us to look like and provide to medical leadership. So during their hospital stay is also something that's the other phase that we took a look at for this survey. So we ask here, did you find that you and your child were safe, secure, supported? Again, these are things that are a lot more qualitative than quantitative, but it's okay because that's what we want, their experience. And when we said at the very beginning that nothing like this existed yet, this is why, because it's not just for research, but it's also for the experience of the mothers. We also want to make sure that they're receiving education and counseling. And you'll notice here that we are including a really wide range of what the supports are. Where's the most need? And breastfeeding options, obviously that's one, but also community resources. What warning signs should they have been looking for? Depression, postpartum depression, family planning. Were they given this information? And if not, that would be an area for us to address moving forward. And then here, these are very critical areas as well. We're talking about mental health. We're talking about smoking cessation. Are we referred? Are we changing the paradigm, shifting the paradigm so it's a support care environment, not punitive, where child welfare is being called, or some of these other more punitive resources are being called? Are we engaging women differently, especially when we're talking about women of color? So this is where we get a little bit into, we do have some questions around any sort of complications or challenges that they may have had post-delivery, and then what happened, how were they responded to or not responded to. And that's a consistent theme that you see throughout a lot of these questions as part of this survey. And then their postpartum, post-discharge, what happened when you were at home? We know that's one of the most difficult times, highly fraught times in terms of stress, complications. What happened when you called and asked for some support? How soon did people respond? If you raised an issue with your medical team, were you engaged quickly? So those are some of the pieces that we wanted to know. The questions, were kind of the same in terms of broadly, what was your experience, but it gets a little bit more detailed according to the phase of the process. We want to make sure, and wanted to make sure that this was empowering. You heard a lot from Cheryl about how power and the voices of these women were taken over so many years. And we're hoping that you as well as our community partners want to give that power back, want to give that voice back. So we're so appreciative for any support that you can provide to move this forward. That is what this is for. We also ask them in terms of empowering, who can we share your story with? We want them to be empowered from the very beginning when we get their consents to the very end when we ask them who we're able to share this information with. If they are not interested in our going any further with it, then we won't. So that is really a summary of what's included in this survey. Very, very proud to be able to present it to all of you. And we're looking forward to making sure that as many women as possible are able to access it.